Thank you, and welcome to this panel. I'm personally super excited about the fantastic panel that we have here and the conversation we'll have on a very important topic of how is health going to be impacted by technology. Let me do a quick check. How many of you are using some form of a wearable, a step tracker, or some other such health device? Just show of hands, very quickly. A majority of us. How many of you are actually following the recommendations that's giving you? Fabulous, thank you. So here's the opportunity, I think, and this is what we will get into at some point, is there is a huge potential for how technology can completely transform human health. There's a lot of stuff going on, and we'll explore many of those topics right now. And we'll talk about what will it take to bring that to life and really make an impact in each of our lives, right? So with that, let me just do a quick introduction of the panel here. Yong is from IHiS and the Ministry of Health, and Enno is from Siemens Healthineers.
Hey, everyone.
Reid is actually a doctor, but he's recently set up a startup which works on AI and skincare. We'll get into that. And Philip is also a practicing cardiologist at the National Heart Center, and is also a startup. Actually, he's the inventor of this spider device, which is really the rage right now, and allows for continuous ECG monitoring on the body. So we've got a fabulous group of people, folks from hospitals and governments, clinicians, as well as from big companies which are creating the technologies that are transforming healthcare. So let me do one thing, very quickly, rapid fire. I'll go across the group and ask each one of you to talk about the 2 or 3 things that you're personally super excited about that later in the panel we will dive deeper into. So,
sure. Maybe I'll just start off.
Yes, please.
Start the ball rolling. Particularly from the ministry perspective, Ministry of Health Singapore, I think we are pretty anxious about how AI applied in healthcare can make an impact to our patients and citizens here in Singapore. And in particular for me, it is about also combining some of these commoditized wearables, devices in very different ways, innovative ways, meaningful ways, to make an impact to our patients' outcome and reducing costs for improving productivity. Yeah. So that'll be the 2, 3 areas.
All right, sounds good. We'll dig into that later. Enno?
I mean, for myself and for the company I'm representing, Siemens Healthineers is active in the lab and in radiology. And we're working on a couple of things, basically advancing precision medicine, improving care delivery, improving the patient experience as well. And we believe that digitizing health in general plays a major role in making this happen. Now, if you ask me personally, what are the 2, 3 things that I believe will have an impact? I think breaking down the data silos that we have in healthcare and bringing different pieces of data together, drawing conclusions out of it is one topic. And certainly artificial intelligence is one of the other pieces that we need to watch.
All right, Reid?
Yes. Hi. So I'm actually a medical doctor by training. I've gone to start my own startup. I'm very passionate about artificial intelligence. The gap I'm trying to address is actually all the gentlemen here, they are very well versed in their own roles. But the thing is, beyond Singapore, we have a huge gap in healthcare. So in 2017, WHO published a report saying that half of the world have no access to healthcare. So these people, probably in their lives, they will never be able to see a doctor or get adequate healthcare in the first place. So this is what pains me. And I think that we can tackle it via a few methods. First one will be improving access, and the other one will be lowering cost. So my own passion is actually in artificial intelligence. I think artificial intelligence can encapsulate both. So that is what I'm passionate about, and that's what keeps me driving.
Philip?
So I'm a practicing cardiologist at the National Heart Center, and I started a company that makes a wearable ECG. And I think digital health and transformation is happening everywhere now. So I think, again, in terms of innovation, the areas that you can focus on will be the following pain points, okay? So the first pain point I feel as a doctor is when I see a patient, I have a very short time window where I can analyze the patient's problems, assess the problems, then make a clinical decision. So we have an overload of or plethora of data that we face when we see a patient. So anything that can help to make that more precise would be very, very interesting. Now, the second pain point is that of patients, right? So patients have a lot of data, have a lot of activities that go on outside the hospital, but you only get data when you actually see the doctor or give the doctor data when you actually come to the hospital and tests are done there. So I think anything that can help patients have a better insight of their health, medical health outside the hospital using wearables or using other means will be a very, very critical point in terms of digital innovation. Now, the last pain point, of course, everybody knows is cost, right? So our minister says that the cost of healthcare is going up 15 to 17% a year. Is not sustainable. But if you look at it carefully, the cost is mainly when you step into a hospital, okay? So insurance companies will tell you the highest cost is when you actually enter the last 6 months of your life. But you think of it very carefully, cost is when you first step into the hospital and see a doctor. Consultation costs very high, to see me is expensive, okay? Then with the tests that we prescribe, CT scanners and so on are very, very costly, right? So these are factors that you should consider, and anything that is digital or has a space in innovation in preventing an individual from entering the hospital, I think would play a part in the future as well.
Fantastic. So there's clearly a lot of topics that we can talk about. But if I think about it, it kind of breaks down into a few clusters of really serious amount of work that's going on. There's one which is innovations and technology and how that's changing the care process within the hospital, right? Then, like you said, Philip, there's a lot that's going on which is bringing care and all kinds of possibilities to the consumers in their homes, in their workplaces, as they go around, etc. So there's a lot that's consumer grade now. And interestingly, these two things are getting connected together, right? And then there's also a lot that's going on in research institutes, science and technology, where the way research happens is changing. And we'll explore that a little bit. And finally, actually, there's a lot of tech companies, the big tech companies, the Apples, Googles, and the Amazons and IBMs, which are jumping into the space, and we'll try and explore that to some extent also. So let's talk the first one first, which is how is technology changing the healthcare in the hospital, right? And let's take a few things there. Enno, you make a lot of equipment and diagnostic stuff which goes into hospitals. What are you seeing? What are you driving? And where do you see this going in the future?
Maybe speaking about this in two directions. And one direction I would like to talk about is specifically in radiology and in imaging and how this is being transformed by digitization. And I think the second aspect that's interesting is how do different data pools from various sources in the hospital come together and allow doctors to draw conclusions. Maybe talking about the first one, how is radiology being changed and how is imaging being changed? And imaging obviously being one of the important disciplines in the hospital that are used for doing a diagnosis. So past innovations have often been in imaging that we would be creating devices that do ever better images, ever more detailed, ever more complex, and so on, but still the interpretation would be done by the radiologist, by a human being, obviously. And this we see more and more that with the help of technology and also with the help of AI, that this process is being augmented, where you have the radiologist looking at a final result, but basically where a machine can tell you quite a lot of things that you would be seeing and would be able to tell you where do you see something's wrong with the patient, yeah? Where is a tumor, where is some other topic that the radiologist should be paying attention to. And I think this is something we will be seeing more and will certainly become more relevant.
How do you think will that change what the radiologist does then, and how what service the patients get through this process?
I believe it will expand the role of a radiologist from reading an individual image into, if you will, an information broker in the hospital. I think the radiologist and this is a debate we often have with radiologists as well, how will the job transform? I think radiologists will certainly be needed, but the job will transform in a sense of being augmented by technology, and technology might tell you for most of the basic things that you might be observing what you're seeing, and the radiologist then has to make a judgment call what to make out of this, and is it right, is it wrong? And I think it will be rather going into that direction. It will make, obviously, the job much, much more efficient and effective because the human being can concentrate on the topics where it really matters rather than doing all the hard work. Yeah? And to give you a feeling, if you do a CT chest scan, CT scan, there you might be talking hundreds of images that are being taken. It's very, very hard for a human being to go through and see all the details. And this is something where actually an AI-powered algorithm can do a lot and already pinpoint to the topics where you where the radiologist needs to look into more detail.
Chee? Yeah.
Maybe coming from the ministry perspective, I'd like to share a point about radiologists, right? I mean, the fact is, it takes about 6 to 8 years to train a specialist. Radiologist is one area. We have an aging population, which also means that our healthcare workers are also aging. Don't forget that. We can't even see the images clearly, right? That's a real problem. Now, when AI comes into the picture in healthcare, we struggle with that. Frankly, the radiologists freak out, right? This technology is going to replace me, all right, and make me redundant as a specialist that was trained for 8 years in school. But when we looked at the technology and how we apply it, and this is the part about how we meaningfully apply application that makes the difference. So in this case, we know that AI today is not quite explainable. It is not quite there yet. And what do you do? One is that we can ignore it and say, no, until you reach the point where it's explainable, then we use it. Or we can choose to apply it in a safe way that allows us to improve our productivity. And in particular, our case is, for example, in retinal image scanning, we use a simple AI to do a simple classification of normal versus abnormal. Simple, right? And guess what? 70% of normal cases got eliminated by AI because the AI is tuned to do a very narrow task, and the left over 30% are read by the human being. So there it goes. The productivity suddenly increases, and we just focus the human being to read the very, very complex 30% abnormal cases. That's productivity, right? 70% of the workload got disappeared overnight.
And also accuracy, I assume.
Accuracy goes up, well, right? So you see how we apply it. Despite the constraint of AI, the limitation of AI, we apply it meaningfully. I think we can harness value.
So Reid, you're in the middle of this, the whole AI opportunity.
Yeah, so I'm a doctor, I'm a medical doctor, and also an AI guy. So I would like to put my perspective into this. I don't think that if you want to build a good AI system, we should remove humans from the equation. We want to build AI that is good, human-centric. So like Mr. Chua has said, we want to involve doctors. I don't think as AI, I want my AI to replace myself as a medical doctor or replace my colleagues. But the idea is that we are faced with an ever-exploding population. Okay, healthcare systems are getting unsustainable. We need AI to help automate some things and to help alleviate the burden on doctors. So AI is not new. So it's strange why people suddenly seem to grasp with the idea of AI, but a lot of radiologists are already using CAD, computer-aided diagnosis, for mammography. It has been there for a while already. So the idea is for us, as tech startups, to pursue what we call human-centric and good AI. So AI that is, we try to make it as explainable as possible, and then we also always want humans to be involved in the whole process. So the idea is not to replace doctors, but to help them.
I just want to make a comment about artificial intelligence. So artificial intelligence actually means machine learning. Means the machine is learning something as opposed to an algorithm, right? So an algorithm is something that says this is black and this is white. So algorithms are a lot better accepted in the medical field than artificial intelligence. And why? It's a very simple thing, right? So artificial intelligence, if you put in rubbish, right, it will analyze rubbish and give you out rubbish. That's one problem with artificial intelligence. Now, the second thing about doctors is that we have another sense called compassion, empathy, and the need to try and help people, regardless of health condition. So when I see a patient, it's not necessarily his health I'm trying to help, right? I'm trying to help his entire environment. I have to think about the social issues behind the background of the family and so on. So AI cannot look at these things correctly at the current moment, right? So anything that is being adopted by hospitals, we always have what we call a qualified specialist or man in the loop, right? So for example, in radiology, even though a lot of it is done by AI, at the end, the guy who signs off is the specialist radiologist has to sign off the report, even after AI has gone through it and so on, right? So we are not afraid of actually losing our jobs as healthcare providers. But in this respect, what I think most people or most healthcare providers don't understand is the benefit that it gets from the first problem I pointed out, right? So we have a whole huge plethora of data which we are trying to analyze, but we haven't got a sense of it. So if you pop up the electronic health records, right, I see 2 computer screens with approximately 1,000 fields. Okay, and I've looked at this and analyzed all this. This is where I think AI can really help the doctor as the patient as well.
Yeah, maybe to add to this, I could actually not agree more. I think the chance of, in general, digital means in healthcare and AI specifically is probably to give a bit of the human touch back to healthcare as well. Yeah, if you visit a doctor nowadays in a modern healthcare institution, you might be seeing the doctor actually punching numbers into the system or observations into the system for, I don't know, 2/3 of the time, and they might be looking at you every now and then as well. But I believe it might shift quite a bit of the attention that a doctor has back to the individuum, giving it more of the human touch and letting the machine doing quite of the tedious work that humans are, quite frankly, not good at in the background. And machines are typically better looking at 1,000 data fields and seeing what's the correlation. Computers are better possibly in future on looking at thousands of images and recognizing what's the pattern in it, but they're certainly not better in the human touch in terms of bringing different pieces from different angles together and seeing what's the bigger picture. And I think this is how it might transform healthcare.
Let's throw a couple other variables into this. So Philip, you initially mentioned that one of the challenges that doctors have is a patient walks out of the hospital and you have no information about how they're doing now. You took that challenge on and you created this device, Spider, which allows patients to go home and you can still see their ECGs, and if there are any events, you can get notifications on them. I want to throw one more thing there, is what for example, last year Apple did with the watch, and not the ECG that they built into the watch, but the thing they did before that, which was they recruited 400,000 people into a study with which they were able to detect AFib cases in that large population. So I want to, with that, let me throw that in and say, how are those things changing the role that you can play as a clinician in providing better care to patients?
So I like to break this down into the 3 Ps, okay? So the first P is personal medicine. So any accurate information you can get from an individual, be it a watch or wearable or whatever it is, and I mean accurate means medically accurate, right? So one of the issues with the Apple iWatch, and I'm a big Apple fan, okay, I use everything Apple, is that the information that it gets from your watch, the iWatch, is only prospective data. So if you feel like a thump in your heartbeat and you want to record the ECG, it's something that happens retrospectively and not prospectively, right? So you will only record things that are happening in front, and that means that you can miss exact data. So you have to be careful with the gadget as well. So personal medicine requires you to have accurate tools, accurate wearables that pick up the important thing that you're looking for, in this case, the vital sign parameter, okay? Now, the more we can get information, the better the more accurate the information is. So there are 2 types of information that you are going to get eventually if you look at it. One is called snapshot information, right? So things like your chest X-ray is a picture, right? If you get a heart rate for over 1 minute, it's a very short snapshot information piece that you're getting. Glucose monitoring or skin issue, right? There's a picture that you see, it's one piece. But your health is a continuous thing that is going on. So for example, your heart beats about 80,000 times a day. So you want to get any information, you actually have to record the 80,000 heartbeats. Otherwise, you won't get accurate information. So continuous data is also going to play a very important part, and that is where a proper wearable that gets that information will be very, very useful.
Great. Chee, as this becomes possible, there's medical grade diagnostic devices, and there are all of these consumer grade devices as well. And then you combine with that AI and all kinds of other services. How do you or governments look at this from the point of view of how we match what is possible with making sure that this is dependable, patients can rely on this, etc. If you can share some perspective on that.
Yeah, I mean, typically when we evaluate emerging capabilities and technologies and applying that to healthcare, this is where we look at 4 dimensions. One is looking at, from a patient perspective, what does it take for the patients to adopt that solution? Because in healthcare, we're dealing with something that you don't like to do. Eat less and exercise more, right? So we're doing against what a human nature desire. And it's tough, right? Because that's what healthcare is all about. The second part is doctors. I mean, doctors is a challenge. For a clinician to accept a technology requires them, because they're ultimately going to sign it off, ultimately they need to be convinced that the technology works. They have to go through clinical trials, they have to go through certification, verifications, in order to certify that this thing works. Last but not least is this area around regulation, and regulations exist for good reasons. All right, it's to protect the safety of our patients and consumer. Now, if you don't cross that line with a regulation, anything you do in healthcare will only be in the consumer world, will only be useful as a proxy. So there's a difference between a clinical grade medical device that's class 8, 1, 2, or 3 under FDA, or there is a consumer grade. But I'm not saying that consumer grade is not good enough. Sometimes, and we are seeing technology where consumer grade technologies like Apple Watch, some of these proxy indicators are used as correlated to medical record to predict certain conditions and diseases. So that opportunities are coming, right? And the last point is really about the activation, the behavioral science to consumer, to patients, and eventually also to clinicians ourselves and healthcare providers. Because ultimately, somebody needs to decide who is going to pay for this technology. Because if you think about it, if I put a $1 million AI engine from Siemens and make a not so good radiologist better, shouldn't I deduct 10% of his pay to make him better? Or should I be paying it extra and subsidizing extra technology so that, and ultimately, if the outcome is the same, then why is the ministry needing to subsidize such a procedure or capability, right? So we got to be very clear in terms of who is the buyer of that solution, because sometimes it's not clear. Like having a wearable, giving it to a patient for free, and ultimately the beneficiary is the patient, but it also ultimately save the healthcare systems in terms of avoiding an extra beds, because it's not necessary to be staying in a hospital. Then who should be paying for that price? Who should be paying for the benefit? Is it a hospital or is it the patient? So there are gray zone right now that we haven't really resolved. And this 4 areas, I think, is something that we need to look at very carefully, balancing that to make sure that this emerging capabilities and technologies are adopted by our consumer patients.
So Reid, you're trying to bring one of these emerging technologies to life. So talk to us about what you're doing. Is that a consumer grade thing? Do you want this to be a medical grade one? And some of the topics that Yong raised, how are you addressing those?
Yeah, so I think as AI is an emerging field, definitely there are risks, okay? Nobody's saying there are no risks, and definitely AI companies must mitigate this risk. But regulation aside, AI is necessary. Why? Because first thing, half of the world is uncared for. Second thing, healthcare budgets are not sustainable. No healthcare system here is truly free, even in welfare states. You still have to pay via taxes. So there is a need. And if there's a need, AI might feel that need if we mitigate the risk. The idea of putting down AI just because it has certain risk I find it's myopic. We must try to push AI to make it better, make it more accurate. And I think putting a human factor inside can resolve a lot of issues. So the accuracy of AI in medicine, in specific, it's very well established. There was this paper by Andre Esteva in Stanford where they use AI to determine whether is it a suspicious melanocytic lesion, possible a pigmented skin cancer, or is a normal mole. The AI was on par, if not better, than a board of certified dermatologists. Okay, AlphaGo has demonstrated that the AI can compute not via logic but an intuition to beat the #1 gold player in the world. So this demonstrates the efficacy of AI. So, of course, AI can increase accessibility and also lower costs for everyone. So that is a very important aspect of AI. So in regards to radiologists, so the idea is that I feel the most beautiful thing about AI is not the fact that it can think like a human. In fact, it can think better than a human. But I think the most beautiful part of our AI is that it can learn. So as a medical doctor, if you ask me to see 30 patients a day, I'll be damn tired at the end of the day. Probably the last 5 patients, I might not be able to learn so much from them. So that's the thing with radiologists as well. So I can tell you honestly, if you have a certain scan, you ask 2 doctors in a hospital, they might give you different interpretation, right? So that's the issue with training humans. Some of them may not be trained. Okay, let's say radiology is very subspecialized. So let's say you are a doctor trained in cardiac MRI. If you ask them to see a sports injury MRI, they may not be so familiar. So that is also the danger with human training, because medicine is so well subspecialized that we may not be very good generalists anymore. And that's when AI can come in and add in a safety net. So let's not think of AI as a threat, but think of AI as a possible safety net. Nobody is going to ask you to see an AI doctor, because as a doctor, if I ask my patient to eat my medications, he's going to say, perhaps. So we know 80% of the time he's going to eat it, and 20% of the time it's not. Can you imagine your phone app telling you to eat medications? You just mute it, right? So we must never remove humans from the equation. We must try to learn how to, even as clinicians, we must try to learn how to embrace AI, because it provides us a safety catch.
So let's move back to the human. And one of the biggest challenges in Singapore and across the world are chronic diseases, right? Basic stuff like diabetes, hypertension, etc. And we started with this poll, which is how many people, everyone knows that you should work out a little, walk certain steps, eat healthy, sleep well. How many of us do that? So it kind of boggles my mind that everyone understands that. It's undisputable. Most people don't do it. 70% of the population is wearing wearables which are telling them you're not walking enough. What's the holy grail here? How do you crack this problem? How do you get people to do what they need to do to lead healthier lives? What's your perspective? And I'll just go across the room here. Chee.
We've done so many experiments trying to break this challenge, and to be honest, we have not succeeded. But there's some lesson learned. Maybe I'll share a few examples. All right. So for example, where we have diabetic patient who say, hey, you know what, your glucose is not well monitored. You know what, current technology, prick yourself 3 times a day, send me the vitals. Okay. And some technology company comes along and say, you know what, I created a continuous glucose monitor. Slap to your wrists. You can monitor 24/7 for the next 14 days. Just stick to it. All right, you can shower with it, you can sleep with it. Continuous glucose. But it's probably about triple the price of pricking yourself. So you either bear the pain, you prick yourself 3 times a day, or you wear it at 3 times the price. So if you look at it from that perspective, no normal human being, not even say a patient, will prick themselves for the rest of their life. And 3 times a day, by the way. Right? So that doesn't work. And clinically, that's correct. We want the vitals 3 times a day so that we can titrate your medication, monitor your condition for a period of time, all right, so that we can manage your condition. So this is the part where when we tried it and we keep trying it and we keep using apps and app after apps, it did not work. But once we break through that thinking, the same technology but applied in a different way suddenly changed the equation. For example, in some recent experiment, we say, since you have a continuous glucose monitor, you could monitor yourself 24/7 for the next 14 days, because the battery only lasts 14 days, and then you throw that away. You experiment on a group of patients, they try it, and when they eat a bowl of cereal in the morning, their sugar spikes. For the last 20 years, they didn't know that cereal is not good for them. They had half a plate of chicken rice. Seems okay. One plate of chicken rice, their sugar goes up the roof. Suddenly, after 14 days, they realize what they eat, what they can eat, what they cannot eat, affects their blood glucose. Suddenly, taking that away, you have seeded the idea of half a bowl of chicken rice is all you could take as a diabetic patient. Suddenly, there's a mindset shift. Suddenly, there's a lifestyle change. And suddenly, you manage your condition without medication and sometimes without any more wearables. There's no need for any more apps. But you see that simple device is a new technology, but applied in a very different way, suddenly breakthrough, right? And this is what we want to do. That's what I call Combi Innovation. You're trying to combine innovation from different various technology in a meaningful way such that it really makes a difference to activate the patient to do something differently. That's what we're trying to do in healthcare. It's to activate, it's to motivate, it's to change the way you used to do things, but do it differently, right, to manage your condition.
Great. Just quickly, if anyone wants to add, we've got a couple of minutes left, so yeah.
Maybe I can add what I see in the future as a doctor. So one thing which I think is really happening now, for example, the spider ECG that I invented, is that data is becoming a lot more fluid, right? So we call the data liquid data because, for example, if somebody is wearing the spider in the US, I can get his ECG in Singapore, see his ECG in Singapore about 3 seconds later. So the data is really becoming extremely fluid as well. Now, the second thing that is very exciting, I think more so than AI currently, is that even with people who can't afford healthcare, right, what can they afford? They have a smartphone. So the smartphone is really becoming the replacement of healthcare in many respects, okay? So the smartphone is becoming your apparatus, your interface to see a doctor, make appointment to see the doctor, collect your information, and so on. So that's one thing you can look forward to in the future, and the smartphone is going to get better and better. Now, in terms of what we look for in the future, what I wish for is something like this, okay? So every time you come to see me or to see a doctor, it's very hard to get information from you. You give me a little bits and pieces and so on. What I would love to have from you is a whole health persona. If I can have a digital health persona, and I look at the health persona, I can get a lot more information and I can put my mind and focus to it and try and solve your problems. Now, the thing about a digital health persona, if you look at it, you can collect it anytime. And if you're outside the hospital, while you're moving around in the MRT and so on, you can put information to that, and that builds the accuracy of that digital persona, right? Now, you can also front-load it to me, right? Meaning that you can give it to me before you see me as a physician. So I have a lot better picture of what I'm dealing with when you come and see me in the clinic. Now, usually we have a lot of patients in our hospitals. We have 30 patients, all right, in a clinic, and we spend 5 minutes, maybe max 10 minutes. So if you can get good information from that, that would be very exciting. So what I see is this. You don't have an electronic health record in the future. What you have is a decentralized platform where you have your own personal avatar. This is your personal digital persona, right? That you can pass around to different hospitals. It will be anonymized, okay? So don't worry about the PDPA and so on. So you pass it around to someone you want to see and say that, okay, this is my persona. Can you look at it and see what you think is the best way to treat me or to help me in my case? So that's what I think may happen in the future.
Great. Maybe very quickly, Reid.
Yeah, so I think what Dr. Wong said is very true. I think the smartphone is a very important device for us in the future. So the idea is that at MEDGIC, what we are doing is that we are trying to analyze skin conditions, right? So we are not trying to say that we are a medical device or we are a replacement for doctors. That's not the case. But just imagine you live 5 hours away from the nearest hospital. Okay? You're not going to see your doctor every time just for a simple mole. There will be sometimes this sore appears and you're not very sure whether it is a cancer, an early cancer, or is it something that you can ignore. So the thing is that for many people living in around the poverty line, for them to even travel 5 hours to go and see the doctor, the transportation fee is going to break their bank, much more to actually pay to see a doctor. So we are transforming in the sense is that we are trying to suggest to people what it could be. We never say that we are going to be replacement for a doctor. And the best thing about MEDGIC is that we are learning. So we actually launched a few months back, and based on the idea, and it's a very well-established idea that AI can be as good as a doctor in a very narrow task. That is to recognize and analyze specific skin conditions. AI can't dispense medications for you, but at a specific narrow task, we can do it. It's very well established. Okay, so in this respect, MEDGIC has grown quite a fair bit, and we are analyzing a lot of skin conditions every day, and we are learning exponentially. So as I mentioned to you previously, a doctor will get shacked out after seeing 30 patients a day. But MEDGIC never tires. It just keeps learning, keeps getting better.
Right, I think
we are far ahead of the game.
I think we can boot it a little bit on that one. I'll try and close. I think fascinating discussion, and unfortunately we don't have time for questions from the audience, but I feel really excited about where we're going with this. And I think I represent the panel when I summarize maybe 3 or 4 things that I noticed. There's a lot going on across in the hospital, in homes, in science, in tech companies, etc. But coming together, I think the potential I see for this is one, is this is really going to accelerate our understanding and our ability to treat the humankind, right? There's still a lot we don't know about the human body and how things work. I think there's a massive acceleration happening in that. Second, that will allow us to do very targeted, individualized, precision, personalized kind of treatment options, versus in the past things were very, averaged out kind of activities. The third thing, which is super exciting, is with this kind of data, AI, etc., I think we will move from being largely post-diagnosis treatment to predicting and preventing serious medical issues to happening or mitigating the impacts of them over time through better control, right? And then finally, hopefully, as we talked in the opening as well, this will bring far better access to a lot more people to much better healthcare at hopefully much lower costs, right? Wow, I mean, that would really be an awesome outcome for the whole world. And I think many of us, and hopefully many of you as well, are doing your bit to drive innovation in healthcare so we can achieve that objective sooner. So with that, I thank each one of you. Thank you so much. Fantastic conversation. Really appreciate it. Thank you. Thank you. Very nice. Thanks so much.
Thank you so much to our wonderful panelists.